Hey guys, welcome back to my channel. I am Dr. Upasana Gosalia and today's video is dedicated to my most special set of patients, and no prizes to guessing that they are the kiddos. I have received so many requests from all the mommies and daddies asking me a lot of questions about how to take care of my child's teeth, and so I thought I would address this topic in today's video. But before I start, I hope you guys have subscribed to my channel, but if you haven't, then quickly press that red button you see down below and subscribe to get regular updates on all videos, because I'm going to be sharing many such videos on child dental care and some frequently asked questions as well. So most of these questions that I have received on social media from you guys, I have classified them under three major subgroups. Those questions related to the 0 to 1 year olds, the next set of questions for the 1 to 5 year olds, and then the next set for the 6 to 13 year olds. So let's begin with the little ones, or the 0 to 12-month-olds. The most frequently asked question to me for this age group is, when do I start brushing my child's teeth? And the answer to that is very simple: as soon as the first tooth erupts in your child's mouth. Now before this, I know that all you moms clean your child's mouth using either a muslin cloth or a wet cloth. But once the tooth has erupted, just using a cloth might not be sufficient. So what I personally recommend to all my patients is you can start using a very simple finger brush. Now this is made of a very soft silicone material. You just have to slide it onto your finger, and since it's so soft, it does not really harm or injure your child's mouth at all. And it's very simple and easy to use. I've left the link in the description box below and you can easily find it at a lot of online stores. Alternately, you can also use some special super soft brushes that are specially meant for this age group. The next question obviously will be, do I need to use a toothpaste? The answer is no. For such young children, you definitely don't need to use any toothpaste. If you feel that just cleaning with a toothbrush is not sufficient and their teeth are still feeling a little sticky, then what you can do is just dip your finger brush or the toothbrush in a small bowl of warm water and try to clean using that, but no use of any toothpaste. The next very important question that I have received again from a lot of moms is it okay if my child sleeps while bottle feeding? The answer is definitely a no. I know how difficult it is to put a baby to sleep, and the easiest way for most moms out there is just either to feed them or give them a bottle in their mouth. But this can have some really damaging effects on your child's teeth. So I would definitely recommend against it. What happens when your child sleeps while feeding and you don't clean your child's teeth is that the leftover milk in their mouth will give rise to some cavities that we call as baby bottle caries or nursing bottle syndrome. Now, I'm sure none of you parents want your children to have cavities from such a young age. So in order to prevent that, it's best that you avoid feeding right before they sleep, or the best you can do is clean your child's mouth so that no milk is left over. The next and the last question for this age group is, why does my child put everything in his mouth? Well, I think this is a very common complaint, and all of you must have faced this issue with your child. This is nothing but something called as teething. This typically starts between the age of 6 to 9 months when the first tooth starts to erupt in your child's mouth. And because this is something totally new to them, since their gums are very, very irritable, the children really love to put whatever they can find into their mouth. It could be their toys, it could be their pillow or bed sheet, or sometimes even their parents' fingers. And there's literally nothing that you can do to avoid it. The best way to prevent your child from falling ill while doing so is that you sterilize all their toys and whatever that you feel they're going to put in their mouth. At least once a day you can maybe dip their toys in hot water, and that would really help with the cleaning and sterilization. And alternately, there are also some teethers that are very easily available in the market, and I'll also be sharing the links in the description box below. The children really enjoy sucking and chewing onto these, and they are very easy to sterilize as well. So yes, moms, you can give that a try. So now let's begin with our next age group, the 1 to 5-year-olds. And in this age group, the most frequently asked question to me is, when should be my child's first dental visit? And there's a very simple rule, I give all my patients to remember this, and that is first dental visit equals child's first birthday. So somewhere around your child's first birthday is an ideal time for their first dental checkup. Now by this time, most likely in your child's mouth, about 4 to 6 teeth would have erupted, and this is, I would say, a great time to visit your dentist and get their teeth checked. What your dentist will do is check for the alignment of their teeth, whether you're able to clean their teeth properly, and also the alignment of the jaws, and also check for any deformities in your child's teeth. So definitely don't miss out on that first dental visit. The next question is, how do I train my child to brush his or her own teeth? I think training your child to brush their own teeth should begin from a very early age, and typically the 1 to 2-year-olds are in that age group when they really want that hands-on experience. They will want to try everything out by themselves. So make good use of this and try to kind of engage them in this activity. And I'm going to share with you 3 very simple and easy tricks that you can try out with your children, which will encourage them to start brushing by themselves. So the first tip I want to share with you guys is, encourage your child to be more involved in this activity. Don't let it be something which is forced upon them. And to make them feel more involved, what you can do is allow them to pick a toothbrush of their choice. It could be either their favorite cartoon character, or you could also give them a few options of toothbrushes and they could pick their favorite color. And the second thing that you can do is, in order to make this whole morning brushing routine a little more fun, set your favorite brush time song. Now this could be their favorite nursery rhyme or some catchy song that they always like to listen, and set it to about 1 minute's time. With children, they tend to get bored of activities very fast, and they'll barely pick their toothbrush and brush for 5-10 seconds and they'll want to throw it away. But if you're playing that song for a whole 1 minute, day after day after day, they will know and learn to brush for that entire 1 minute, and slowly they'll adapt to that routine. So this trick has actually worked very well for my patients. Do try that one. And the third tip that I want to share with you parents is, don't forget to reward your child after they perform well in brushing. So it could be something as simple as giving them their favorite breakfast or some 15-20 minutes of extra playtime. But this will really make them feel special and they will look forward to brushing the next day. Also parents, it's very important to keep in mind that you need to demonstrate the right way of brushing to your child. So when your child is brushing by themselves, you can pick up your own toothbrush and look into the mirror and actually teach them the correct way of scrubbing, etc. Because children tend to pick up things from their parents very quickly and very fast. So do this and do it with them, and make this like a fun morning activity that you both do together, rather than it being just the child and you forcing it onto him. The next question again is, do I need to use toothpaste? So yes parents, after 1 year's age you definitely need to use toothpaste, and the size of that should be as small as, I would say, a rice grain, or maybe just a small smear of the toothpaste that leaves a hint of color on the toothbrush, not heap loads of quantities. And it's absolutely okay if your child doesn't spit out that toothpaste and swallows it, because these special kids toothpastes are formulated in such a way that it's okay if they swallow it. If you're confused and you don't know which one to pick for your child, I've left a few links in the description box so you can check them out. Now the third frequently asked question I would say is, why are my child's teeth erupting late, or why are they not aligned well? Firstly parents, I want to urge you all to stop panicking. It's not like if your friend's child has got say 5 teeth erupted by a certain age, you cannot expect that your child will also have the same number of teeth and the same sequence, etc. Every child is different, so don't compare your child to another. But having said that, I would like to say that if your child is about 1.5 years of age and you still see no signs of teeth erupting or teething in their mouth, then I think it's safe for you to visit your dentist again so that they can do a little more detailed examination for what the problem is. And as far as alignment goes, don't be worried at all, parents, because once your child's jawbones start to grow, these teeth tend to self-correct themselves and come in their correct position. So there's really nothing that you need to worry about too much at such a young age. And it is very, very normal for all milk teeth to have gaps between them. That is actually how a child's mouth is designed to be naturally. So don't freak out about that. Now the next frequently asked question: are chocolates good for my child's teeth? I know that in today's age it is absolutely impossible to avoid all that chocolates and sugars and sodas, etc. But I would say everything is good in moderation. So don't encourage your child to have too much of those chocolates and sweets. Max, I would say, is 1 per day is okay. I too have a sweet tooth and I love having my chocolates. But a very important thing to keep in mind over here is you cannot forget about rinsing your mouth after that chocolate. You have to remember to do it and encourage and build that habit in your child from a very young age if you want to avoid cavities. So the root cause of the cavities is not just the sugar but also the inadequate brushing or cleaning. So if you're having, say, chocolates and sugars in a little moderation, but you're maintaining good oral hygiene and brushing twice a day and also rinsing after every small meal, I think the chances of your child developing cavities really reduces. So inculcate that habit in them. Don't keep them away from chocolates, but at the same time, keep it in moderation. So the last question for this age group is it okay if my child sucks his thumb? No, parents, this is definitely not okay and I don't recommend this. I urge all you parents to stop this habit from a very early age on. I know it's going to be difficult because initially to leave this habit, your child will be irritable and you'll have sleepless nights. But if you're going to stick by this habit, in the long run, your child can have a lot of defects in their mouth region. The jawbone tend to get structurally deformed when the child sucks onto this thumb night long, and also the front teeth start getting frayed, and your child could also start being a mouth breather, which can have a lot of other problems in future. So please stop this habit from a very early age. I'm sure you're thinking, but how do I do it? And it's going to be so difficult. But this thumb sucking is such a vast topic and I think it calls for a whole separate video altogether. So do let me know if you want to know more about this in the comments below. Now moving on to my next and the last age group, which is the 6 to the 13-year-olds. And the most commonly asked question to me in this age group is, when will my child's milk teeth begin to fall? So typically the milk teeth begin falling in between the age of 6 to 7 years. And then your child will be in a mixed dentition phase. Now what is this mixed dentition phase? It means that in your child's mouth between the age of 6 to 13, there will be milk teeth along with some permanent teeth present at the same time. And this will go on till about 13 years of age. And by 13, most of your child's permanent teeth would have erupted in the mouth, except for the third molars, and these erupt really late in life, say in between 17 to 21 years of age. The second question for this age group is, when do I start with braces for my child? Now, as a dentist, we really like to see our patients in this mixed dentition period. So what we as dentists do in this mixed dentition phase is, we start with some early intervention. This is called as space maintenance and space retention, and this can really make the job for braces much more easier. So bringing your child early, somewhere between 11 to 13, while they're in the mixed dentition period, is what I would recommend. The next question again, which is the right type of toothpaste? This is, I would say, one of the most frequently asked questions for all ages, but in this age group I would like to just stress a little bit on it, because see, till your child is 5 years and below, it's okay if you don't use a fluoridated toothpaste, but once your child is 5 and above, Using a fluoridated toothpaste is very, very important to prevent cavities and in order to, have really nice and healthy teeth, because this is the period when your child would have learned the correct way of brushing and will know to spit out all the toothpaste. So using a fluoridated toothpaste is really safe. If you're still confused which is the right type of fluoridated toothpaste, what to use, what not, then again I have shared some links in the description box below for the 5-year and above children, so do check them out. Now the next question is, why are my child's teeth so yellow? A common mistake that all parents make is they compare the permanent teeth to the milky teeth. Now the shade of the permanent teeth and milk teeth is never going to be the same. And why this difference, I will be able to help you understand better by explaining actually what a tooth is made of, or what are the layers of the teeth. So the first layer, or the outermost layer, is the enamel, which is the white shiny layer. Below this is a layer called as dentine, and further below, the innermost layer is called as the dental pulp, or where the nerve of the tooth lies. Now the structural difference between milk teeth and permanent teeth is that milk teeth have got more amount of enamel and less of dentine, whereas permanent teeth have less enamel and more of dentine, and that's why milk teeth tend to look more whiter, and whereas in permanent teeth, since the enamel is thinner, the inner layer, which is the dentine, shows through the enamel, which has a slightly yellowish appearance. So that's why the difference, but parents, please don't bother and stress too much about it. This is very normal. All permanent teeth are yellowish as compared to their milk teeth. So that has answered most of the questions that were asked to me regarding child tooth care. And if I have missed out on any and you want to know furthermore, please do leave them in the comments below. But before we end this video, I want to give you guys one short tip, something that nobody has actually asked me, but I would like to tell you about it, and that is using mouth guards in children. Now, the 6 to 13-year-olds, this is the age group when parents are encouraging children to participate in a lot of these sports and activities. It could be skating, it could be boxing, it could be karate, and a lot more. But the problem with these contact sports is that your child's front teeth are at a constant risk. He could fall or have some injury, and he could have broken or chipped teeth, which is not something you want your child to have from such an early age. So the best way you can avoid this and prevent this is by making sure that your child wears a mouth guard. Now, what is a mouth guard? A mouth guard is typically made out of silicone, and it is custom fit and custom made as per your child's jaw and teeth size. So you will have to go to your dentist and he or she will be able to fabricate or make one for you. And make sure that before you send your child to all these different sports and activities, you're well prepared with that mouth guard so that we don't change your child's smile line. I hope you found all these tips helpful, useful, interesting, and you will make use of some of these or all of these. And if you have any further questions, please leave them in the comments below. Stay healthy and keep smiling.